Now, there are growing concerns of waterborne disease in the aftermath of that Cyclone Idai. The heavy flooding has caused extensive damage to water supplies and sanitation infrastructure. James Kambaki is from Doctors Without Borders. He's here to discuss the possible health implications in the aftermath of the cyclone and to give us some updates. James, good morning.
Good morning.
And thanks for your time. It is a busy time having to keep your finger on the pulse of what's going on, especially in these three countries. What are you hearing? You have teams on the ground in all three of these affected countries. What are you hearing from them?
What we hear, especially from Mozambique, is that in Beira, this town, the city of about 500,000 people, 90% of infrastructure has been completely destroyed. All the surrounding areas is flooded. So there's still rescue continuing. So many people are still stranded and stuck. Of course, there's displacement. Health structures have been destroyed. MSF, Doctors Without Borders, were actually doing advanced HIV treatment in one of the hospitals. That hospital managed to treat about 1,500 people just the second day of the aftermath. The situation is severe, it's bad. Our team is now on ground. They have started treating diseases, of course, but of course repairing infrastructure is quite big now, because then people can actually know where to go to get services. And of course we are alert in terms of monitoring the waterborne diseases and try as much as possible to prevent those, and of course to treat as well.
So how difficult is it for you now to get meds to the affected areas, let alone people getting to the facilities or what's left of them to get treatment?
Initially it was quite bad, because you can only access Beira through boat or by air, and I think it's still the case. So we are trying to ship in quite huge consignment of materials to help with the treatment. We have already started distributing non-food items, hygiene kits that are quite basic but really important in trying as much as possible to prevent certain diseases, that at least people have a little bit of hygiene. And I think because the reservoir of clean water, treated water, has been depleted by now, we expect that we should possibly be able to supply some, the tablets to actually like chlorinate the water so that people can drink clean water. But it's a huge undertaking, and it requires a lot of resources, and also all the other organizations needs to come on board. Now,
we've just had a story about the 3 helicopters being deployed. Has that, to your knowledge, eased the situation a little bit at the moment in terms of getting supplies?
I cannot say now that immediately. What I know is that we have been preparing huge consignment of cargo that will possibly have landed already in Mozambique. This is really huge, because it's big intervention that will take place.
How advanced, from what you're hearing from your workers on the ground, how advanced are the cases of disease that they are seeing? Are they still treatable? Are many of them still treatable? Are others just hopeless at the moment?
I think what we're seeing is that, of course, we're treating watery diarrhea. This is the beginning. We have set up our outreach facilities now, kind of like trying to map up a little bit where we could access people and possibly treat them. So, of course, watery diarrhea is something that we are already treating, but we expect, of course, this to increase in the coming days. So our emergency preparedness is a key element for us to be able to actually like come in and possibly treat better in the future. But in other parts of the region, that is Zimbabwe.
They already had medication shortages before the cyclone even hit.
Exactly. And we were worried also about the antiretrovirals that they were actually taking. So if they don't get this replenishment of supplies, that will actually be something that is a bit worse. We know in Chimanimani, where our team has already accessed the district, that is a population of about 30,000 people. The consignment of antiretroviral is one of the key major things that we are concerned about. And also in Malawi, in Sanje, where we had working with Ministry of Health to implement HIV program, about 14 out of 28 districts has been flooded. So we expect possibly also those antiretrovirals to either be destroyed or not there. So replenishing those is really key. It's really key for us to focus on that. But of course, in Beira is a bit of different approach that we're going to actually face. But our teams is in all those 3 locations.
So it seems that the aftermath, the after effects of Cyclone Idai are going to linger, I suppose, long after the cleanup, if when that happens, is actually done. Thank you so much for your time and for the updates. James Kambaki from Doctors Without Borders.